Okay, this subject of this video will be AIDS and Swaziland. In Swaziland, we have approximately 27% of the population of the adults have HIV. Of that, 90% are, according to a study by University of Washington on HSV, HIV, completed in 2006, 80 to 90% of those have HSV. Okay, which means if you times 90%, the worst case scenario, times the 27, it comes up to 24% of the adult population has both HSV and HIV. Also in not Switzerland, but also in Swaziland, which is a southern African country, they are predominantly infected with HIV version 2 or HIV-2. Now, looking at Swaziland, according to the World Health Organization's survey, global survey on HSV in 2012, there's approximately 31% of the Swaziland population infected with HSV, which is herpes simplex virus number 2. Okay, which is a groin sore. So, we have 24% have both HIV and HSV, and 31% of the population has HSV. So we take the 24% combined, divide by the maximum number of infected with HSV, which is 31, comes up to a little bit, something in the neighborhood of about 77% of the population has both HIV, well, that has HSV has HIV. So, let's look at this another way. Using the University of Washington study, we know that 80 to 90% of HIV victims has HSV. Now, if we reverse that and calculate it for HSV victims, it's a little over 3/4 or 75% of your HSV victims have HIV. That means most of your HSV. That means most of your HIV victims have HSV, and vice versa. Most HSV victims have HIV. There was a time that wasn't the case. HSV has been in a decline in Africa ever since 2003, and possibly even longer than that. I don't have any data back further than that on Swaziland. But we do now know that HSV infection rates are down, and new infections from HIV are down in Swaziland. What does that mean? For some reason, HIV-2 and HSV are commonly infecting each other. When one has it, more than likely you have the other one. Could hiv-2 be more contagious than hiv-1, which is what black American men have and homosexual American men have, and most of the rest of the world has as well? How many of those southern African countries, most of which are on the top 10 list of infected countries as far as percent of population, how many of them are HIV-2? Most. Most of their infections are HIV-2. You get out of southern Africa and there's almost no HIV-2 cases. Well, maybe I should rephrase it. That was the Spanish way of phrasing it and using English words. HIV-2, not hardly anybody outside of those southern African countries have it. What does that tell us? It tells us HIV-2 must, in some way or another, be infecting people with HSV. The percentages are just too high. You could run a study on it to confirm it and get people killed just to be able to confirm it, or you can just stick with the mathematics from the already existing studies. Or you could run a mathematical study. There's ways of using statistical calculations, basing it off of available data that doctors have on, did this patient have HSV? Did it have HIV? See, the primary focus ever since the 2006 study by University of Washington on HSV and HIV has been to determine whether HSV had to be there in order for HIV to be contracted. But there are other groin sores other than HSV, and there are also other ways of catching it. Hemorrhoids is a sore in your ass that can bleed. Of course, you've got needles. If you're sharing needles, intravenous drug users. So there are other ways of catching it besides groin sores. So that it didn't come out, that study didn't come out to a perfect 100% doesn't worry me. It doesn't matter to me in my calculations, other than to say that I've got a percent here left remaining that's probably due to those factors, meaning the hemorrhoids and the needle sticks. Looking at Swaziland. Why is it HIV-2 in countries like Swaziland that are infected with HIV-2 have such a high morbidity rate to 8 and infection rates? Well, when you get out of the HIV-2 areas, it drops to a third in the worst affected countries, about 5 or 6%, versus in excess of 15%. A third as many. Well, I thought I would make that comparison and bring that question up to people to think about. Thomas was out here.